I'm Danny. I survived bladder cancer in 2023, and I'm a dedicated bladder cancer advocate. Let's go over some bladder cancer warning signs and symptoms. One of the most noticeable is blood in the urine or hematuria. Your healthcare professional can detect small amounts of blood in the urine, but if you keep an eye out yourself, early prevention is key for this type of cancer. I personally did not notice any blood prior to my cancer diagnosis, but shortly after I would describe it as tea colored, and it appeared after I took a long hike. Another symptom I noticed later was lower back pain. I thought it was from age and possibly spinal issues. More importantly, I did not investigate it further. I had radiating lower back pain, primarily on my right side, for perhaps a few years before my bladder cancer diagnosis. A grape-sized tumor was removed from my bladder. Even though now I can get an achy lower back, it's obvious the warning sign I was receiving. An increased urge to urinate or increased frequency of urination may be natural with age, but we must pay attention closely. Always check with your healthcare professional if you have a hunch something may be wrong. These symptoms could be significant. About 3 years before my bladder cancer diagnosis, I began to go many times during the night. Felt a little more pressured to get to the bathroom in time. I passed it off as approaching middle age, possibly an old prostate. In my case, it turned out to be a warning sign of urothelial papillary carcinoma, or NMIBC. Loss of appetite, unexplained weight loss, bone pain, and foot swelling could all be indicators of possible bladder cancer. Go get yourself checked out. The tests are quick and simple. They could be the difference between muscle invasive and non-muscle invasive bladder cancer or metastatic bladder cancer.